Name this heart block. Number 1, name this heart block. So that one was actually a 3rd degree heart block, or a complete heart block. If you paid close attention, you would see that all of the P waves march out consistently, all the QRS complexes march out consistently. However, there is no communication whatsoever between the atria and the ventricles. This is why we call this complete heart block, or complete divorce between the atria and the ventricles. Number 2, name this heart block. I'm getting better at this thing, y'all. So that one was a 2nd degree AV block type 1, or a Mobitz type 1, or a Winky Bach. It's called so many different things, but what you'll notice about a 2nd degree type 1 is that the PR interval is winking at you. In other words, the PR interval is getting progressively longer and longer and longer before a QRS complex is dropped altogether, or a P wave is not conducted. So you'll see a lonely P wave out there with no QRS complex to follow. Number 3, name this heart block. So that one was actually a 2nd degree AV block type 2. And what you'll notice about that, if you look closely, is that the PR interval remains constant. And this is much more scary because our QRS complex is dropped, or our P wave is not conducted suddenly and unexpectedly without warning, like we have in a 2nd degree type 1, where the PR interval progressively lengthens before the QRS complex is dropped. Make sure you favorite this video so you can come back to it later. Make sure you hit that follow button so you'll get more like this, and go Vols.